Welcome to Staying Healthy Through COVID-19, Prioritizing Mental and Physical Health While Social Distancing. I think we'll just run through just a little bit about who I am and what is our practice. A little bit about COVID-19. You're probably all very familiar with it and inundated, but maybe some insights that are a little different. And then let's talk about how to preserve our mental and physical health as we go forward with this and as we navigate the future, which is in many ways still uncertain, but a lot of things that we can do to affect it and make it a more pleasant one. Just a second here. So that's a picture of me. I'm Chris Nussbaum. I'm a fellow of hospital medicine. That's what the FHM stands for. That's some extra stuff after your MD that I'm proud of obtaining. It means that I have extensive experience practicing in the hospital with complex consultative medicine in hospital, as well as being a primary care physician locally. And after 30 some odd years, I decided that what I wanted to do is try and fix what I thought was a broken healthcare system with a concierge practice where the relationship is direct between myself and the patients. So we're blind to insurance. We don't really worry about that. What we do is take some of the pain points out of medicine that people have. There's no waiting. Our appointments are measured in hours rather than minutes. We see you at home if need be, and we follow you in the hospital very closely too. So our practice has always been one that's looked outside the box and has tried to innovate and find ways to be a guardian of the healthcare needs of our patients and to take a proactive approach to doing things that might be different, but that are about being well. It's a membership-based practice. It doesn't really matter if you have insurance or you don't. If you have any interest in it, we take care of individuals 18 years and above, all over the place in hospital as well as at home. And so here's our website at www.insightlifecare.com, where you can learn a little bit more about us and about what we do. Been in the Brandon community since 1988 in multiple different levels, have been very active at Brandon Regional Hospital, and at one point or another I've been on staff at every hospital in the city, including Tampa General, St. Joe's, over a career spanning more than 3 decades. Now let's jump right into this discussion. Just wanted to mention that having that personal relationship with a doctor is very useful. If you don't have a primary care physician right now, it's good to try and find either a telehealth system or a virtual system like we have where you can access a doc. And if anybody wants more information about that regarding Insight Life Care, please feel free to reach out to me or Hannah through the chamber. We'd be very happy to help you if you have a need. Well, let's talk a little bit about what's going on. Pandemic, hashtag COVID-19. I don't think there's anybody around anymore who doesn't know what COVID-19 is all about, but we do all know that beginning in December, for the first time, human beings encountered the SARS-CoV-2 virus, a novel coronavirus that was very efficient at spreading itself and causing huge harm. Worldwide now, we're up to 1,942,360 cases, nearly 2 million cases that we know about. Of course, not everybody that needs a test has gotten a test, so those numbers are more than likely vastly underreported. The good news is that of that amount that we have seen, we know that over 465,000 people have recovered. The bad news is over 121,000 people have passed as a result of the complications of this illness. The disease COVID-19 being what happens when SARS-CoV-2 causes illness. In the United States today, up-to-date information suggests there are 587,000 plus cases recovered, about 44,000, and more than 23,000 people have lost their lives. We are hardly out of the woods with this disease, despite the fact that mitigation and social distancing seems to be helping a great deal. So what can we do to make it through this? Because we know it's serious, we know it's deadly, we know what this virus can do. We know that we don't have that many tools because human beings have only ever seen this virus for the last 4 or 5 months. So that leaves us with social distancing. Social distancing makes the ability of the virus to spread far, far less. And when people all work together and practice the mitigation suggestions that have been suggested at first and then imposed in certain places, most of you know Hillsborough County is now under a curfew at night to try and keep people from congregating. That social distancing has definitely made a difference. We can see the numbers of hospitalizations and deaths and the surge in severe illness definitely flattening in communities where social distancing has taken hold and where it's been implemented early and efficiently. In particular, we can see this in places like California. And if you've been watching the news a little bit, you'll see that in New York, it seems like they're finally starting to turn the corner, even though still lots and lots of illness, lots and lots of distress there. But social distancing is where we all are now. We're not allowed to go and do the things that we're used to doing. And if we do try them, not only is it perhaps in some places illegal, but it's most certainly very unsafe. We're adjusting to a new normal, and that's difficult. Life as we know it has changed. We have to ask ourselves, how are we going to get through this? What can we do to feel good about things, to manage the fact that we may at times feel very alone or isolated? And how can we create some healthy habits? What are the things that we could do to get through this? And, asking for help and offering help is always a positive thing for human beings. And having a positive set in your mind, deliberately seeing yourself as doing well, can be a huge help. That we can and we will get through this. We can and we will tolerate some discomfort. And we have a good future to look forward to. Let's talk about some ways that we might get there, because we can. So, in short, we want to find what feels good anytime we're under stress, anytime we're having a difficult time. The habits that we already know, if we're people that have adopted habits that help us relax, if you generally tend to go for a walk, or if you've been someone who knows how to sit down with a good book or a magazine and relax, if you find preparing or having a good meal gives you comfort, or if you have a meditation practice, like my good friend Hannah was mentioning, or myself, this can give you lots of support during times of excessive stress. And whether you're a senior citizen, or whether you're a young person, whether you're someone in battle, or whether you're just the average workaday citizen, these techniques can be helpful for anybody from a normal person retired at home to a Navy SEAL. We have to start wherever we are. And we know that the most effective situations we can adopt for any type of stress are for us to set goals and then do things that we know make us feel good. When we set goals and we have some sort of routine, we generally tend to do much, much better in stressful and anxious situations. Some of you may be familiar with the great Admiral Bill McRaven, who was in charge of the Special Operations Command here at MacDill. He wrote a fantastic book called Make Your Bed, which was a summary of several important tenets about having a routine and setting goals, mentally rehearsing goodness, talking to yourself appropriately, and controlling your anxieties and arousals to deliberately create a state of calm and a state of efficiency. And we can adapt some of those ideas too, and we'll go through those here as we move along. Routine is important. Routines and things that we normally do kind of anchor ourselves in our world. They give us comfort and feel familiar. And most of the time, they're things that we like to do, from this gent right here having his morning coffee to people who relax and maybe get online and communicate with other people. When you anchor yourself with these routines, it'll definitely help you cope with the unpredictability of a situation like social distancing during the coronavirus pandemic. If we build these small little structures in, they can have a huge impact. And don't trivialize the value of such a thing. The idea that McRaven mentioned of getting up and making your bed is a small accomplishment that even any person can benefit from, saying, look, I did that and I did it well. You can move through your day knowing that you got up and you got moving in a positive way. These little hurdles that we jump each day tend to add up and create substantial improvement in a feeling of anxiety or distress. Some of you may be familiar with cognitive behavioral therapy, or CBT. CBT is very useful for people that are being treated for anxiety or distress, depression. But more importantly, and perhaps more modern therapy, is something called ACT. I'll just mention a little bit of it here. This is acceptance commitment therapy, or acceptance and commitment therapy. And in acceptance and commitment therapy, rather than in CBT, what we're looking at is not to try and make all of our bad thoughts go away. In fact, the idea that we'll never have any bad thoughts or that we won't have any uncomfortable emotional states is probably flawed. All of us know that at some point in our lives, we may feel more down than up. Our best is one thing one day and another thing another day. We can't always do our best. And we have to be able to confront and look at failures and difficulties and friction in our lives. with social distancing, some of the things that we counted on to help us get through that may be lost. So ACT, or acceptance commitment therapy, can be very helpful in the situation. And I'll give you an analogy in a minute. But in ACT, we accept our reactions, whatever they may be. We don't try to make the bad thoughts all go away. And we embrace them and get with them and be present with them. Then we help ourselves choose a good goal, a valued direction, know what we want to achieve, and embrace what's going on around us and take action. And as an example, there's a couple of different ways of looking at a situation. I'll give you an analogy that the great thought leader and motivational speaker Tony Robbins has mentioned. You know, if we have a garden, there are some people who come outside, take a look at their garden, there's weeds all over it, and they go, oh my God, there's weeds everywhere, I can't handle it, oh, my garden's been taken over, the heck with these weeds, I'm done. Nothing ever happens, and they never get to grow any of the things they wanted in their garden because they're too upset worrying about the weeds. Then there's the other extreme where people come out and go, hey man, check it out, weeds. Well, I don't care. I'm not going to do anything about that. Yeah, I think I'll just go take a nap. And there's no engagement. There's no acceptance. There's basically no reaction either. It's just whatever. And the weeds take over the garden and nothing ever happens. The more valued position to be in is that place in the middle with balance where we say, aha, weeds. Wow, they really pissed me off, but I expected them. I knew they were happening. I knew they were coming. And yeah, I know weeds. I can handle it. They're not permanent. I'm going to choose a valued direction and take action. I'm going to weed my garden. I'm going to deal with those weeds. I'm going to celebrate the fact that my garden is growing. And hey, you know what? At the end of the day, the flowers, the vegetables, whatever it is that I wanted in there are going to happen if I can accept what's going on without emotionally overwhelming myself. So acceptance commitment therapy is well practiced by realizing, you know, there's going to be clouds in the sky, and that's okay. We're going to get through this coronavirus scenario. We're going to be okay. But for now, we have to accept our situation and remember that it is not permanent. Take positive action, set goals, and mentally rehearse doing well. And there's some other techniques we'll go through. This type of therapeutic maneuver is useful. So perhaps if you're feeling anxious and you're having emotional weeds in your garden, you're seeing something as fruitless or as potentially with no positive outlook, recognize that you can and will tolerate some discomfort and search and strive for the good. There's a solution there for you with embracing where you are and moving forward. Now, that can be easier said than done, but little things slowly, one step at a time, and most people can get there. Self-talk is a really important part of how you feel and what you do. You know, I've heard people say, you know, perceive, believe, achieve, or maybe in different, order, but basically what you tell yourself and how you talk to yourself has a huge impact on how you go forward. So promising yourself that you will talk in a positive way about your health and happiness and future prosperity and current situation with gratitude is really, really positive. An attitude of gratitude, as well as knowing for sure that you can go forward and believing in yourself, can be invaluable. So watch yourself talk. It's not useful to sit around and say what's not going to happen or what will happen that's bad or that everything is terrible, but rather search and strive once again for the positives in your life and tell yourself both in your mind and out loud those positive affirmations that can help you feel better about yourself. I like this picture of a person flexing their muscles. The emotional muscle is a strong one. These types of affirmations are incredibly powerful. If you can think of some positive things to tell yourself on a regular basis, part and parcel of your daily inner discussion with yourself, or even out loud, maybe when you're taking a shower, maybe when you're waking up and sitting in bed and blinking your eyes, choose a positive self-set, choose a positive mental rehearsal, and deliberately, positively put yourself in a good place. Saying my body is healthy, that I'm smart, that I'm tranquil, that I'm under control, or that I want to take a new step and be more positive in the future, and declaring and demanding that you be at peace with all that is around you and that you can flow with it and make it a better day. If you choose these types of positive affirmations, although they may sound a little silly to some people, or perhaps some people shake their heads and say, oh, that doesn't work. Trust me, when you do it on a regular basis, this is something that celebrities, famous athletes and Navy SEALs do on a regular basis with effect. This can make a big difference in how you're feeling and in what happens. I strongly recommend you try it. There are other things that we know of that people can try that generally are well accepted to bring health and wellness, but from personal experience, I can tell you have massive impact when you just start slow and do more. And yoga has an endless array of personal and anecdotal evidence to show how useful it is, but there's also plenty of stuff in the medical literature to show that people that are yoga practitioners or yogis that do some yoga on a regular basis improve their blood pressure, improve their resting pulse, improve their positive sense of wellness, live longer and better with less morbidity and mortality, less hospitalizations, and anyone can do it. You don't have to be super flexible, and you don't have to do every single exercise perfectly. And most of us, certainly not me, won't look like that very attractive yoga instructor at the front of the room. The idea is to do what you can. You don't have to win your yoga. It's not a competition. You can do the pieces of it that feel comfortable and adapt and adjust. There are an endless array of YouTubes and online yoga sessions. There's classes that are being done virtually all over the place, and just learning a few moves and doing them on a regular basis can be very helpful. A few people have said to me, well, doc, I don't have time for any of that. I can't, sally around all day long doing yoga for an hour and a half. You don't have to. Maybe 15 or 20 minutes as a beginning practice could do a lot for people that have aches and pains, and emotionally and from a stress reduction standpoint, it is very, very useful and well proven. So if you've never done it before, give it a try. If you are into it, you can attest to your friends and family the value and extend your practice. And, I think you'll find that this is extremely helpful. Prior to coronavirus, I regularly recommended this to my patients and have many individuals who've participated and noticed an improvement in their back pain, in their headaches, in their arthritic symptoms, and in particular in stress and anxiety. Very, very helpful indeed. Another thing that we all know is useful is to get outside. There's evidence that just being outside, being in nature, can make people feel better, and that's well understood. Now, of course, in the time of social distancing, we need to be smart about how we do this. It's advised at this time that when you go outside, you wear a mask, as much to prevent you coughing on other people as for them to not cough on you. If you're jogging, there's some discussion about how far apart we really should be, since people that are breathing hard and heavy may leave, if you will, an aerosol plume. So just keep your distance from others, but definitely get outside, get an opportunity to see the beauty around us, go for a walk, find an unlikely location where other people are not congregating, and just sit and enjoy the scenery. I was talking a little bit earlier today with Hannah about creating a sort of drive-in movie for people by getting in their car and going to unusual sights and sounds with the windows up and a sandwich and a glass of something good within the car. But getting outside, going for a walk, jogging, or doing something like a little hike can have huge impact on your mental state, and also changing your scenery, changing your perspective, really, really positive. If you have a dog, walking a dog obviously is a wonderful thing for relaxing and for changing your mindset if you're feeling down. I like to talk a little bit about the nutritional aspects of feeling well and of dealing with the stress of social distancing. A happy relationship with food is important in the sense that what you want is to not deprive yourself, but rather to make sure that you're making the healthiest possible choices that you can. There's lots of discussion about foods that improve your immune system or that enhance your immunity. Plenty of discussion in the medical literature before and after coronavirus about what supplements, what trace elements, what vitamins and minerals might be the most useful. And there's lots of controversy about that. Arguably, I would tell you that processed foods seem to be negatives, and fresh and whole foods that are not processed are probably better for you. That's just a generalized statement. There's a little challenge obviously going on right now with shopping. The grocery stores may not always have your most familiar or favorite foods. On the other hand, less in the way of fast food and less in the way of restaurant prepared processed food is probably a healthy alternative. So I like very much this slide where we're seeing vegetables and fruits and legumes and things that are fresh and are lightly sauteed, maybe in a little olive oil, those are all a better choice than stuff that's coming out of a package and is highly processed or has a lot of added carbohydrates or fat. Try to make an intelligent choice. You can also have a lot of fun with this, because if there are things that you've never tried before, now's the time. My neighbor had never had a bok choy Chinese cabbage, but wound up making a really delicious coleslaw out of it. Some people I know have never tried a kiwi fruit in their life before. Alternatives are a good idea now to try and see how they make you feel, especially while you have time perhaps at home to experiment. And there are many, many cooking shows, YouTube videos, all sorts of things to enhance your abilities in the kitchen and to give you a little bit of inspiration and motivation. And you can make it fun. It can be a family activity. If you find that that's not something that you really enjoy, the freezer cases do have lots of good, healthy choices. Look through the ingredient labels, avoid things with high levels of fats and salt. Try and make a healthy decision, and that will definitely have an impact on your emotional state and how you're feeling. Combine that with some of the things that we've been talking about, and you start to get that little goal setting, positive and deliberate movement towards better emotional and physical health. Sleep's a big deal. I've had a lot of patients contact me and let me know they're having a hard time sleeping. And of course, when we're anxious or worried or scared or under threat, trying to get to sleep is a difficult situation, no doubt about it. Obtaining good sleep can be very challenging when there is a significant amount of stress. And for some people who weren't sleeping that well before all this happened, it can really be a dilemma. So there are some basic things that most people know about, but we'll just go through them and talk about them for a second. First, the darker the room, the better the sleep quality. So little buzzers with lights on them, chargers, distracting things like phones that are lit or tick, anything that puts a light in the room, an indicator, all of those, the more you can mask those off or get rid of them, the better. The less distractions, the better. Actually, watching television in your room is probably not healthy for sleep, although a lot of people do it. Remember, the light coming out of that LED screen may actually activate your brain. Same thing with your cell phone or your iPad. If you'd like to read before bed, perhaps reading by an incandescent light, a normal light without fluorescence, and with a regular old-fashioned book may be more restful than actually working with a screen. And we certainly recommend that you use your bedroom as an area where you go there to sleep. That is a very positive thing to do in your bedroom. You don't want to have lots of work activities, lots of distracting things, stuff that you have to take care of right next to your bed. Go there to sleep. Make sure the room is very dark. You may want to set your thermostat down a degree. A cooler room where you can snuggle up under the covers seems to be very enhancing towards sleep. Recommend about an hour before you're wanting to get to sleep that you disengage, that you try as hard as you can to take any of the tasks or work or issues that you have on your mind and put them aside, and for the next hour, ready yourself and your body for sleep. Start thinking about things that you find relaxing, and importantly and deliberately put yourself into a relaxing mode if you can. Take the steps that we've talked about, perhaps to try some of the things we're going through here. We'll talk about meditation in a minute. Stretching might be good. A warm shower or bath for some people is good. Do the things that pamper yourself and get you ready to sleep. Wear comfortable clothing if you like to wear bedclothes to go to sleep at night. Make sure you've done everything you can to enhance your comfort and darken the room with quiet and give it a shot. Of course, if that doesn't seem to be enough, there are medications and other ways that can help you. You can contact us or your primary care physician for some both over-the-counter as well as prescription things to enhance sleep. It's not wrong during times of severe anxiety to get help with sleep, and people often worry about addiction for those medications or think to themselves, oh my God, I don't want to have to get on something. Generally speaking, what we see is that when people are having episodic insomnia or when they're having a rough time with anxiety, if they need medication to help them, when the anxieties are lifted or when coping skills improve or when the situation and the crisis is averted, there isn't a desire for those medications. And the addictive potential of these medicines is very, very limited when you are using them correctly. Anyway, feel free to reach out to us or to your usual physician if help is needed in that regard. We mentioned about the positive nature of self-talk, and visualization is part of that as well. You definitely focus on the things that you think about, and what you focus on can attract positives in your life. So if you think positively and visualize the future that you want to see, if you can begin having a mental rehearsal of what it is that you want to feel and do, when thoughts of anxiety come through, if you can visualize more positive times, more positive moments, and more positive outcomes, this is going to give you more clarity, more purpose, and be settling for you when you're both anxious and depressed. Um, Breathing is critically important. The onset of lots and lots of different breathing techniques have gained popularity over the last 10 or more years. And we know that the way that a person breathes affects their entire body, their blood pressure and pulse, their resting nature of activity, their sense of wellness. You don't necessarily have to do a particular breathing study or breathing school. I think most people have found in their lives that if they take a deep breath and breathe out slowly, that they find that soothing and calming. And in fact, again, from both athletes to individuals at home to trained special forces commandos, taking big deep breaths and letting them out slowly has been shown to calm them, steady them, reduce anxiety, and improve performance. So we have one technique that you can use is a count to 4 technique, where you breathe in for 1 count, then breathe out for 2 counts, breathe in for 3 counts, breathe out for 4 counts, breathe in for 3 counts, now breathe out for 2 counts, breathe in for 1 count, breathe out for 2 counts, and repeat this system to slowly but surely gain control of your breathing, which helps you center emotionally and physically and relax and improve your body. When you're in this state, if you practice like this over time, what you'll find that even when you're at your most uptight, even when you're having a really difficult time, you can stop, take control of yourself emotionally, and be far more effective for whatever it is you want to accomplish. Again, tying in with the goal setting, mental rehearsal, self-talk control, the control of your arousal and anxiety, and a deliberate attempt to maintain calm and perspective whenever you're feeling uptight. I'd also like to talk with you a little bit about meditation, of which I can't say enough good things. Um, this is a quote from Thich Nhat Hanh, who's a very famous Vietnamese Buddhist monk who has been a strong proponent worldwide of mindfulness meditation, and actually is the individual whose disciples teach here in Tampa at the Florida Community of Mindfulness, which you'll find up in Seminole Heights. And when we're able to leave social distancing and can travel, I recommend to anyone who has an interest to check out FCM, the Florida Community of Mindfulness, where low cost or free classes are available to people who would like to delve more deeply into this technique. You do not have to become a Buddhist. You don't have to support their Buddhist shrine or temple, but it is welcoming and open to the public and to all people. In fact, I've actually taken patients there who are having problems with insomnia and difficulties with anxiety and depression, and have had some pretty good success in individuals that went through the 4-week introductory course, which is a couple of hours a week. You can now do portions of that class online through their YouTubes. And in fact, Florida Community of Mindfulness has a very extensive set of YouTubes and talks. You might want to skip some of the very extensive talks by one of their leaders, Mr. Fred Epsteiner, and just go for the actual guided meditations. But check that out online. That'll be in the connections and links that Hannah will provide for you at the end of this talk. But mindfulness meditation is a technique that can help you center, visualize, and calm yourself, and also perform at your highest possible level going forward when it is practiced regularly. And indeed, mindfulness is like exercising any other muscles. If you do it regularly, they tend to grow and become more efficient. And that's certainly the case with meditation. Incidentally, you don't have to sit cross-legged. You don't have to be in a lotus position, but being somewhere comfortable is extremely useful. It is possible to learn mindfulness meditation without a lot of teaching. And just for a second, let's just think about this for a moment. The simple centering exercises that one uses when they first take up this mode of meditation have to do with concentrating on your breath. And your breath is an extremely useful tool in this regard because it's always with you. So no matter where you go, you're always ready to do some meditating and some self-centering if you would like to and if you find it helpful. Most people do. It's very well established that it's able to improve your well-being and physical health. And here we're talking about both physical and mental health, which are intertwined, of course. But with mindfulness meditation, you can calm yourself. During periods of great anxiety, this has had a huge impact on individuals. And as a practitioner of mindfulness meditation, I can tell you from my own personal experience how valuable it is. As an exercise, you need only find a comfortable place anywhere that you want to sit. In fact, when I went to learn mindfulness meditation, rather than sitting on a cushion or on a little prayer pillow, I decided to try it sitting in a regular chair because I figured most places I would go would have a chair, but not that many places I would go would there be a prayer cushion or a little pillow. I was a lot more comfortable just sitting in a chair. Some people like to do it with their eyes lightly closed. Some people like to do it with their eyes partially open. It's up to you, although I find closing your eyes limits the amount of distractions. If you were to sit in a chair in a comfortable position, and try this if you want, if you're following along and have an interest, with your feet flat on the floor, your back well positioned and supported on the back of your chair, your hands loosely and comfortably in your lap, your eyes closed and your head tilted just very slightly forward so that your neck is not stiff. Now, soften your jaw, soften your shoulders, relax your shoulders and your chest, and take a few deep, slow breaths. And where we go with mindfulness meditation is to begin counting our breath. We're just going to quietly and steadily breathe in and breathe out, counting 1, and then breathing in and relaxed, breathing out, counting 2, and keep going like that, counting our breaths. When and if you notice that your mind has wandered to other topics, don't get upset. Don't get mad at yourself. It's not that you've done it wrong. That's perfectly normal, like clouds floating through the sky. We're simply going to bring our attention back to our breathing and continue to count our breathing. Even very accomplished mindfulness meditation gurus will sometimes hold a class of simply all they're doing is counting the breath, even with people who've done this for years, because this is such a fundamental and powerful technique for centering yourself, for being present in the moment, for controlling your arousal or anxieties, and for actually bringing good health to your body in a very positive way. Again, lowering blood pressure, improving your state, improving your overall level of adrenalines and hormones. Indeed, this is extremely calming and can be done at any time. I recommend, if you're interested in this, again, to check out some of those YouTubes from Florida Community of Mindfulness, or there are many other mindfulness meditation apps. You might want to take a look at Calm, C-A-L-M, on your smartphone. That's one that I think is pretty good. There's another one called Headspace that isn't bad. All of these are designed to be calming and restful and can be part of a regular practice of taking control of your day and taking control of your state of emotional and physical health. Strongly recommend you give this a consideration. And for anybody who wants to take it further or has questions, again, I'd be happy to chat with you more. And there are some links that we'll provide that I think will be great. While doing the mindfulness meditation, consider what emotions are you actually feeling? What is it that's actually driving those emotions? Can you go to the root cause of what's bothering you? And if you can you release that? Again, can you see that clouds will form in the sky and that blue skies will follow? If you find that you're distracted, come gently back to your breathing. You'll find that it calms you, and you'll find that you're able to do it better and better the more you practice. So when you're counting, if you suddenly realize you're thinking about something else or you're feeling anxious or distressed, try to come back to your breath, and you'll see that that's extremely helpful. In short, if you can figure out what it is that makes you happy and brings you to some sense of stability and emotional well-being, those are the things that obviously you want to do more of. A lot of times when we're under stress, we move away from the things that are supportive. And of course, with social distancing, we're a little bit stuck because we can't always do the things that we used to do, but we can adapt. If you're somebody who likes to go for a bike ride and there's a way and a path to do that with a mask or a facial covering, you can still do it. If you want to, you can maybe obtain through the mail or through being shipped to you a bike trainer for you to use at home. If you're someone who likes to go for long walks, by all means, try and do that. Make your nutrition a fun thing to deal with in your home. Try some new recipes, eat on a healthy basis, indulge yourself a little bit, but be smart. Get the best possible sleep that you can by working towards calmness, and about an hour before you're going to go to sleep, setting yourself up for success in a sleepy way in a cooler and darker bedroom. Set goals every single day so that you have a pathway to being successful and feeling like you've accomplished what you wanted to for a given day. Call a friend. Look at some pictures that perhaps you've never organized. Check out some music that maybe you never saw before. Watch a movie, of course, maybe some classics that you've never seen or something new that you always wanted to watch. Take that hot bubble bath or that relaxing bathing scenario and dream away a little bit while you're relaxing there. Memorize or learn a poem, especially one to say to a loved one. Tidy up your room. That's probably always a good one. Create something new. Look and strive for something different in your life. Read a book you always wanted to. Or practice that mindfulness meditation that we were talking about, which is so potentially powerful. These are all just some ideas. There's tons of other ones. You can be as creative as possible, but creating these new ideas and sticking with them and putting them into use on a regular basis will help you. More recently, some of the things we've been doing that we've had a lot of fun with is we had a virtual glass of wine with some friends. Set the cell phone up on a tripod, uncorked bottle of wine, and just had the same sort of chat we would have had if we were together, but using the cell phone. You have a pretty good regular routine around here where I get up and do my regular yoga in the morning. And I've been very lucky to have personal trainers that I can Zoom in with on a call just like this one, who take me through my workout. And it seems like even though I feel pretty disciplined, no matter what, they always drive me harder than I would probably drive myself. I'm a client of and have great things to say about the Fred Astaire Dance Studio in Valrico. But anywhere and anytime you can get some online teaching for dancing. That would be a fun thing to do if you have people around to dance with, but you can also do it solo. There's as many different opportunities online there as there are people that are doing it. So by all means, if you always wanted to salsa, but were a little bit embarrassed to try and learn, or if you don't know how to waltz, but might be at an event in the future where that kind of music might play, or perhaps you're on a cruise with your loved one and they're playing music and you're all dressed up and you want to be out on the dance floor, now's a good time to pick up something like that. I think you'll also find that when we reach out and we help one another, it's extremely nurturing and imbuing great, great feelings to our souls and to, our entire bodies. When we help one another along the way, we all do better. So if you're in a position to do so, you can donate to some of the nonprofits that are responding to the coronavirus crisis. There are lots of people, obviously, that are struggling right now who could always use some help. Reach out to somebody that you know and see if there's any resources that you have that you could share with them. Spread a little kindness and be extra patient with people around you. It's hard right now for a lot of people. Some of them aren't thinking clearly when they're doing things. They're a little scared. They're a little upset. Share with them some of these techniques if you find them useful, or point them in the direction of where to get help, because at the end of the day, we're all in this very much together. If there's any silver lining to this gray cloud that we're in, it's that perhaps we've all realized that what happens to one of us happens to all of us all through the world.
Okay, guys, so now we're going to go ahead and go over some of the questions that you all have asked in the chat. So thank you to everyone who sent questions our way, whether you sent them publicly or privately. I've tried to separate them into kind of two general topics, one being COVID and the other just being mental health questions. And then there were a few questions just about Insight Life Care. So we're going to start off with the questions about COVID, and some of them are a little bit related. So I've tried to kind of gather them, by topic. But the first question, Doc, is why don't we have more information about COVID-19?
Okay, well, that's a great question, and the answer is pretty simple. You know, human beings have never encountered the SARS coronavirus dash 2 before December of last year. This is very, very new, and as a result, there hasn't been research or a lot of understanding of this particular novel virus, which behaves in ways that we're still learning on a daily basis. There's a lot of global research going on, but because humans have no immunity and we have no experience with this, it's absolutely a new scenario. Very much a new frontier, like it was in 1987 when I was chief resident in Newark, New Jersey at UMDNJ. We knew there was a virus that was killing young men in particular. We knew that if we caught it, it would be a bad thing, but we didn't know exactly what we were looking at. And it was AIDS, HIV. But at that time, it was a vastly new situation for us to encounter in urban centers. So COVID-19 is a disease that we've really never had in human beings before, the end of last year, beginning of this year.
Okay, the next question is, how come we don't have a vaccine? And when can we expect to see one?
Well, I think that those answers are very much dovetailed. Typically, from an evolutionary perspective, human beings over millennia have been exposed to different infections and viral and bacterial diseases and have built immunity over, thousands of years. SARS-CoV-2 was not felt to be present in the human genome, not felt to be exposed to human beings before now. So we don't have immunity built up. As far as vaccine preparation goes, there are numerous programs. There are over 70 trials going on worldwide of potential candidate drugs and vaccines right now that I'm familiar with. There's probably a lot more, but it takes time to make those work. To the credit of the global scientific community, there are already phase 1 trials where human volunteers are already being, subjected to medications to see if, number one, they're effective against the virus, and number two, are they safe? And number three, in what dose or strength can we actually hope to get protection from these? And there will be, I'm confident, a vaccine developed, and I think they'll set speed records in getting to that point, but it's in a distance. It's still early days. This has been here in the US for maybe about 4 months. So developing a vaccine takes time. As an example, the Ebola outbreak created great fear amongst the global community, very, very virulent, deadly virus. And many of the drugs that were developed for Ebola never actually got past, phase 1 trials, of which there are 4 clinical phases you need to go to. Never really got past phase 1 because the virus was contained, the infection was contained before they actually were able to get those trials fully through the ground. Now, remdesivir, one of the medications that's being looked at very strongly against SARS-CoV-2 for COVID-19, is a medication that was on the shelf for Ebola that has been repurposed and hopefully will have good efficacy against COVID-19. And there's some evidence that that's indeed the case. But vaccine development is being, carried out at breakneck pace right now. There's a lot I could say about that, but we're going to have to wait longer. And part of the reason for social distancing is to buy us time, to get us past the initial wave of infection, to help us develop some immunity, perhaps naturally, for those that have recovered. Maybe we'll be able to harness some of their antibodies by taking their blood and using it for patients. But we need to buy time so that we can have both understanding, the technology to build vaccine, the capacity in hospitals to take care of people when these infections are surging, the proper social distancing and preventive equipment in the community, and the proper behavior so that we don't spread this around on a willy-nilly basis and create yet another surge of virus.
Okay, so a question was just asked that kind of goes along with that, and that is, will this vaccine become a regular given one like that for the pneumonia or the flu?
Well, we all don't really know yet. Again, so little is known in terms of the natural history of this virus. But if it behaves much as SARS, the SARS number 1 virus has, or as other viruses have behaved, then it's very likely that we will be able to develop a vaccine that will be part of our armamentarium against things on a regular basis. And of course, because it's a global pandemic and because virtually every country has been exposed, it will be something that I think, like measles, like polio, like mumps, that every person will be vaccinated against. And the hope would be that such vaccination would create, worldwide positive immunity. And this would be, a distant memory of something that we don't have to worry about that much anymore. That's unknown. I certainly could be wrong about that. Nobody really knows, but the anticipation is that it will behave in this way and that we will be able to both find a vaccine to suppress the virus significantly, and also medications to help treat people who have infections.
Okay, and what does novel mean when referring to a virus?
So the reason why this was termed a novel virus is that it behaves differently than other coronaviruses. So, people hear the word coronavirus and think, "Ooh, this is something new." The fact is that when you have the common cold, that's actually a type of coronavirus. And there are at least 4 major categories of coronaviruses out there, of which SARS-CoV-2 is different. It is a novel or new coronavirus with different characteristics, very efficient transmission, and of course very dangerous, which is why it's being called novel or different or new.
I am worried I might have been exposed to coronavirus. What should I do?
Well, first things first, if you think you've had an exposure, you should definitely contact medical assistance and speak with your doctor or with someone knowledgeable in the infectious disease community to find out about who you were exposed to make sure that you have contact tracing and reporting. You may have no symptoms whatsoever in the early phases of infection, so just feeling fine is not good enough information. You should definitely isolate yourself if you think that you've been exposed. Act as if you probably have the virus and you don't want to expose your loved ones and friends that you're isolated with. If you're all living in the same home, you should probably confine yourself to a given room and a certain bathroom away from others if that's possible. Have the most limited contact with them, and that should not be physical contact. Stay at least 6 feet away. Cover your face, and they should cover theirs when you're interacting. And one generally feels that if you carry on like that for a period of 2 weeks, and there's been no evidence of any worsening or any disease process, that you're in the clear. Now, we've seen data that suggests that somewhere around 5 days after infection, people tend to be symptomatic if they're going to get symptomatic. That could be more like 9 days to develop symptoms. Seems like from the anecdotal information that I've seen that after about 9 days, if nothing's happening, you're probably just fine. And if you were exposed, you've either recovered or developed some kind of immunity. But testing would be a good way to go in that sort of scenario. So there are 2 types of tests for COVID-19 or for SARS-CoV-2 virals. The PCR, or polymerase chain reaction test, is sort of a test of a yes or a no. Do you have it or do you not? And this is a test that has to be done by having a nasal or an oropharyngeal swab. Availability of these tests is limited. It's not as good a testing program as we would like to have, but your doctor or your healthcare public health department can arrange testing for you if need be. Typically, if you go to the emergency room or you go to a walk-in clinic, it's difficult to get a test, although that is improving, but it's still not as widely available as we would like. But getting a test would be useful. Part of the issue about testing is making sure you're protected when you go to the testing center, not exposing yourself to additional individuals, and not exposing others if you think you're infected. So again, speaking with your doctor to coordinate all of that and talk about the pros and cons is, I think, very important. The other thing that can be done is antibody testing. Antibody testing can actually be done in your own home. People can go online and request that test, or you could call our office or other doctors' offices to arrange for an individual to come to your home and draw your blood for the serologic antibody test, which would show you whether or not you had been exposed to the virus or whether you've recovered from the virus, whether you're making the 2 immunoglobulins that indicate that. Some of the weaknesses of that particular testing is that if it's done very early in the exposure and infection stage, it may be negative even though you actually do have it. So false negatives can occur, as they can with the other testing. And also, we don't know what that all really means in terms of immunity. You can have the immunoglobulins, the antibodies that have formed in your body to SARS-CoV-2, which means you were exposed and probably have recovered. But we don't know whether or not that gives you great protection against reinfection, or how long it would protect you, whether there's immunity or whether there is not. So There's still a lot of unknowns, and the data is coming out on that. There's actually currently a National Institutes of Health study calling for 10,000 volunteers to participate. Individuals who have had SARS-CoV-2 are enrolling and having testing done to help us better understand what these tests really mean.
Do you have any meds you prescribe if someone gets COVID-19?
The answer to that is yes and no. If somebody has COVID-19 and we're taking care of them in the home setting, there's a number of things that we can do to ease symptoms and to try and treat any parallel bacterial infections. So depending upon the symptom complex, we might also give them some antibiotics. We might give them something to assist with bronchospasm. We might even give them some anti-inflammatory medications depending upon the stage that they're in. And again, a good percentage of individuals have very mild symptoms. So the supportive care that we might give somebody for the flu seems very similar initially if we think that it's coronavirus. But when people get to the stage where they're more in distress and they have this constellation of symptoms, including fever, sore throat, weakness, and shortness of breath in particular, when they can no longer catch their breath, then really hospitalization is required. And there are a number of experimental treatment regimens for people there. Folks have heard about hydroxychloroquine. They've heard about the remdesivir medication that was originally designed for a different virus. And there are other therapies depending upon the stage of and the severity of the COVID-19 infection. But at home, we do some things to try and help the symptoms and to make sure that any simultaneous infections that might be occurring are taken care of.
Great. So the next question is, I'm considered an essential worker. What are ways I can protect myself and my family?
Certainly, the same rules apply to anybody, even in an essential position. Social distancing should be observed. So stay at least 6 feet away from the next individual, whether you feel like they're infected or not. Normal people may have the virus with no symptoms at all. I like to give people an even wider berth than that, just because they may not be as careful and as cautious as you're being. So maybe a little more than 6 feet is a good idea. Certainly wear a mask if you have access to one. Some sort of facial covering is a good idea. So number one, if you cough, you don't spread anything around. Number two, if someone else coughs, you've got some protection. And also it generally tends to keep you from touching your face, which we know that SARS-CoV-2 can be spread by oral contact or by touching your face, your eyes. So you want to keep your hands off your face if you can. Don't readjust your mask over and over again. Don't touch the mask or the facial covering. Consider that the outside of it is acting as if it's infected and keep your hands off of it. Hand hygiene is critical. The more times you can keep your hands clean, the better. So practice good hand hygiene. Wash your hands after contacting any surfaces. Wash your hands before you do so you don't contaminate any surfaces. And busy surfaces like doorknobs and buttons and handles and shopping carts, consider those all infected surfaces and try not to touch them with your bare hands or wash your hands after you touch them. Remember when you're washing your hands to do it for at least 20 seconds. One little anecdote is to sing yourself happy birthday when you wash your hands, and that kind of gives you enough time to know that you've done a good, thorough job. Hot water is good, soap is better. It helps actually carry the virus particles off of your body. The other thing is, of course, that if you're asymptomatic, you want to stay that way. And if you're out in public or anywhere else, you can't guarantee that everyone else is going to behave perfectly. So having a facial covering, and also I recommend wearing either sunglasses or eyeglasses covering your eyes and keeping your hands off your face, very important.
Okay. Can I donate blood during the coronavirus pandemic?
Absolutely. And in fact, there's a call for donation. It would be a very civic and generous thing to do right now because blood supplies have been strained by this pandemic and less people are donating because they're not going out and they're distancing. So the blood banks have had some shortages. So absolutely, you can donate blood, and it would be a really thoughtful and really very nice thing to do.
Okay, thanks. All right. Can my dog get coronavirus?
That's a heck of a question. It appears that animals can get coronavirus. This is, after all, a zoonotic infection that probably came from animals to begin with. I saw an article, and I can't fact check it for you, but I saw an article suggesting that a tiger in one of the zoos had actually been diagnosed with coronavirus. They knew the animal was sick and they cultured it out. So it does look as if animals can get this viral infection as well, but I don't have any hard data to give you with regard to that.
Okay, is social distancing working at all? Are the numbers lower at this point than what were first forecasted?
Absolutely. There's evidence nationwide that mitigation efforts and social distancing are having a big impact. Some of the very severe surges that were predicted have been softened. That's what they talk about when they're talking about flattening of the curve, that the actual amount of cases, hospitalizations, and deaths are slowing down as a result of the tool that we're using, which is social distancing. Also, as you're probably aware, some of the public health national predictions for the amount of patients that might wind up dying from this disease have been radically reduced in number, dramatically so. And that doesn't mean that the people who made those predictions were wrong. It means that the data they're feeding into the models now are predicting different numbers, and those are vastly different. We're talking about predictions of a couple of 100,000 people dying versus 60,000 people dying, which is still obviously horrifying and terrible, but substantially better by many, many, many times. So yes, these techniques are not only working, but they have to keep working if we're going to all do well. We can't say, oh, look, it's slowed down. We can just go back to doing what we were doing before. We can't resume normal behavior, what we would call normal, until we have a vaccine and effective treatment and good testing. And that's really one of the things we're lacking right now is we can't test enough to be able to know who's infected, who's gotten over the virus, who potentially might be immune. That's where the emphasis right now from a public health perspective needs to be and is being placed.
Okay. How can a nonprofit willing to volunteer in an educational aspect of COVID-19 but lacks funds help?
Good question. I think anybody who wants to help can certainly participate at multiple levels. Definitely speaking with the chamber is useful. They probably can connect you to businesses and people who are struggling right now, whose businesses may have been closed and no sign of opening again anytime soon. There's always contacting the Metropolitan Ministries and other food banks. Feed America is a great place to give some help. Many people are working very hard to try and make sure meals get out to people that are having a struggle. You can look to your neighbors, okay? A friendly phone call or a wave from your front porch over to them is always useful. And, one man's trash is another man's treasure. So if you have some stuff around that they could use, that might be helpful. Definitely can sing out and communicate to any of the other charitable organizations around the Emergency Care Help Organization in Brandon. The hospital can help coordinate volunteerism. And I definitely would reach out to the chamber to see whether or not they can help you coordinate some of this. There are also county-based COVID-19 hotlines for people to get information. And City of Tampa has a couple of hotlines as well that are easily found online. But I think that's great. Anybody who wants to volunteer, there's people out there that need your help.
And we had a few questions, Doc, about being safe while grocery shopping and if there's any groceries to avoid and whether or not it's safe to order takeout. Can you kind of talk on that subject real quick?
Certainly. What's understood is that the SARS-CoV-2 virus probably can survive on surfaces for a prolonged period of time, depending upon what the surface is. Now, no one knows for sure about the infectiousness of those things. I mean, in some testing that was reported, the viral particles, the viral RNA, their genetic material were found much further away than 6 feet in rooms where sick patients had been taken care of. But whether that correlates with actual infectiousness is really not very well understood. So as a general rule, what's been recommended by public health officials like Dr. Fauci and other experts is to maintain the 6-foot social distancing and kind of keep your hands in your pockets. Touch only what you have to. Watch out for busy surfaces like buttons to an elevator, like door handles or doorknobs, like the shopping cart that you're pushing. Disinfect the handle of the shopping cart before you push it. While you're in the grocery store, maintain polite and courteous social distancing. Pick up what you need. And when you get To that point, both before and after, follow your hand hygiene. Wash your hands before touching things. Wash your hands after touching things. As you check out and get back into your car, wash your hands. If you have some hand sanitizer, great. If you don't, you can bring a solution in a little squeeze bottle or a bar of soap and a wet washcloth to get your hands as clean as possible before and after. Hand hygiene is a big deal. Do the same thing when you get home. Unpackage your foods and take the packaging and discard it safely and away. Wash your hands, then wash off your fruits and vegetables, wash off any of your food that may have been contacted, and you can put that safely in your fridge. With takeout, my practice is to encourage the takeout to be left on my front porch or my front doorstep. Say very much thank you, leave tip for whoever you want to before they get there, or pay online. And then once I've picked up the container that the takeout is in, I basically unpack the food out of that, wash my hands, do my hand hygiene after disposing of the container, and then I can enjoy the food. There is no evidence currently that somebody breathing on your food is going to give you SARS-CoV-2. But once again, it's always smart to be wise about this stuff. Make sure your food is properly cooked or hot. If it's supposed to be, you can reheat it if there's any questions. Use reliable sources like you would for any takeout or delivery, and wash your hands. Keep your distance from the delivery individuals. Give them an opportunity to exit your space before you bring your takeout or your delivery food in, and just change containers. When I buy fruits and vegetables, I tend to unpack them into a colander in my sink, rinse them off very well, clean them as I normally would, with hand washing before and after I put them away.
Great. And kind of to that end, am I at high risk when I come in contact with all of the packages I order? So should people be taking these same precautions when they're ordering packages off of, say, Amazon, or if they're ordering groceries from Instacart or Shipped? What types of precautions should they be taking with those?
Well, I think that's a great question. And again, because the data is really limited on that and we don't know for sure, I think being careful is never wrong. I like to quote Dr. Fauci on that as well. He said early on, if it feels like you're doing too much, you're probably doing just about right. So in those cases, when I have packages that are coming in from Amazon or from other sources, if I don't need to open them up immediately, then I basically let them rest. I put them in a corner somewhere and give them a few days to just sit there so that both the contents and anything on the surface of the package, quite frankly, will die off. On the other hand, if I want to open them up, there's nothing that says that I can't spray the outside of the package with a little disinfectant or wipe it down with a dilute mixture of Clorox, 5 tablespoons to 1 gallon of water. Just wipe it down, get it clean, open up the interior, do the same thing. And again, hand hygiene before or after so you can use the materials in there safely. Discard those packages in your recycling bin or in your trash and wash your hands again. Wash your hands before you touch the door to your home. Wash your hands before you touch any surfaces that other people are going to come into contact with. If you think you've had a lot of contact with the packaging or with the material, just like you would if you thought it was dirty or if there was grease on it, change your clothes, clean yourself up, and then you can handle the contents or anything else with some safety. I could be wrong about all of that, but that seems to be the general understanding. It's certainly what the public health folks have recommended, and I think it's just good practice in a general sense because you don't know who's handling what. It does look like companies like Amazon and some of the other shippers are taking increasing steps to make sure that their workforce is protected and has personal protective equipment and an opportunity for them to do hand hygiene as well. So I think that's getting better. And that will certainly, I think, going forward, be part of the new normal because of the potential for so much spread. So I'd be careful in that manner if it were me.
Great, thank you. And then someone asked, how long will this last? Can I expect to go on a vacation in August?
Wow, that's a great question. Part of the problem for answering that question is that we have so much differential infectious rates going on. Some areas of the United States have very low penetrance of this virus, and yet other areas like New York, New Jersey, Detroit have been literally blasted and are thankful for small graces when the rate of people dying starts to slow down. Instead of 700 or 800 people dying a day, it's 500. There's still hundreds of people a day dying from this virus in afflicted places, and we still don't know how to control it besides the social distancing. So in terms of knowing when we're going to be able to take a vacation, that's a really difficult prediction to make. I don't think we're going to be shaking hands together in 2020. That's just my guess. I think it's going to take time for us to get the country back working and start it up again. I think it'll happen in small places, and it'll happen differentially in one places or another, depending upon the evidence of that place having a low penetrance of infection. And I think future plans are a little bit tricky to make. I would suggest we just take it one day at a time to the best of your ability. If you're someone who's out of work and you're thinking over how to make ends meet, look at what the options might be to do things from home or to find employment through other systems, either online or in larger centers like Amazon. I know that sounds facile, but you got to come up with whatever you can right now. I certainly couldn't say with any type of validity or confidence when things are going to return to where we can take a vacation and just go here or there, especially globally, as the response rates in different places seems to be very different.
Someone is saying, I am out of work, living hand to mouth. I don't know what the future holds, and I feel like giving up. What do you suggest for me?
Well, first things first, I want to let you know that you're not alone. Whoever you are that asked that question, and I'm sure there's more than one person feeling that way, realize that there's a lot of us, myself included, my practice, and many, many others just like me, who are both in a position and desirous of helping. So there are a number of crisis hotlines that have been set up both with the county and with local ministries to give you a hand. There's food banks and lots of other types of assistance available for people that are running short. If you're having trouble figuring out where to find those, call us and we'll try and connect you and get you some assistance. Obviously, the federal government is trying to produce a stimulus package, and when they get it figured out and as time goes along, I think that'll be forthcoming and will help a little bit, but it may not be enough. We have to help each other. I'm proud to live in a community like Riverview, Brandon area where people are doing that actively. They were doing it before coronavirus hit, and they're doing it again now. So there are organizations like the Emergency Care Help Organization and also the Chamber that can reach out to you. Gosh, my Facebook page is full of people offering to feed their neighbors or give them a hand if they have to. If you have debts, rent, car payments, things like that, reach out early on to the creditors and the banks. Let them know your circumstances. Most everyone is making adjustments and arrangements right now to make that a little easier for people to deal with. There's a lot of forgiveness and postponing of payments. Your deadlines for things like tax returns and stuff like that have all been expanded. So there's light at the end of the tunnel. Don't give up, okay? You can and will stand some of this discomfort and you will get there. I have had a lot of conversations with some of the older patients that I take care of. Heck, we have a 107-year-old lady in our practice, believe it or not. But the folks that are in their 70s and 80s, in particular, my parents' age, that lived through World War II and lived through the Great Depression, are somehow chuckling and smiling and saying, yeah, this is terrible. We don't think this is funny at all, but we need for you to understand that what we went through, felt much worse, and what other people are going through could be much worse. So somewhere there's someone who would give everything they have for our very worst day. So while that's, small comfort indeed, realize that you're not alone. We can help and we can connect you with people that want to help. So don't be afraid to reach out to us. All of us need help in our lives at some point or another. Let us help you out and we'll get through it together.
What help can you offer to people who are already under a psychological or emotional burden?
Well, I think that we talked a lot about different things that people can do to reduce anxiety, to help cope with the stress and isolation that they experience during this social distancing. Certainly, anybody who already was experiencing significant anxiety, depression, or difficulty emotionally should reach out to their healthcare provider or their therapist and let them know how they're feeling and get support. A lot of times that can be done online or in a visual call like what we are able to do through our practice. And there are medications that definitely can help. There are a broad spectrum of things that can be useful. I would consider CBD or medical marijuana products in the right place as well. So all of the different prescription medicines for both anxiety and depression may be needed. And sometimes those are just temporary things. It's not a permanent or addictive scenario. but during a stressful time in crisis situations, we could all use a little more support. So it's not wrong to reach out, possibly consider either additional therapies or medications. Definitely take on some of the recommendations that we talked about in terms of having a routine in your life, finding the things that make you feel calm and coming back to those things. I think mindfulness meditation is actually much more powerful than people might give it credit for if it's done regularly and routinely. Exercise, getting outside, watching the self-talk, all very, very important. Um, so I sent a little message to my immediate Facebook friends and family this morning about self-talk, and I got a lot of positive responses to that. So keep in mind, we're all in the same boat. We're all doing this together, and you can reach out to your friends and to people that support you now more than ever, as well as your therapists, your primary doctors, your physicians. If you're not sure where to turn, give us a call. We'll be happy to help.
Great. Does hypnosis help with stress and anxiety?
Well, I think the answer to that is a resounding yes. We've seen some pretty surprising and amazing results from our own local hypnotist, who's probably very well known to members of the chamber. So they can call Daniel Cyril, Cyral, at Hypnotic Engagements, and he can do online counseling and hypnotic therapies. We've seen some people overcome a lot of anxieties, stop smoking, lose weight. He's been pretty effective. And in the right hands with an experienced hypnotist, I think you can get a lot of mileage out of that technique, and very, very effective. Yes.
For someone interested in starting yoga but isn't flexible, is this something for me?
Absolutely. I always tell people that, it's your yoga, it's your own individual practice. And as you begin to do it, you need to remember not to try and win the yoga. It's not a competition. If something doesn't feel good, just try and do what you can. And, actually, very good yoga instructors will frequently canvas a new yogi to find out what injuries they've had and talk about things they can do to help work around and through those particular abnormalities. Now, if you're doing yoga online, you may not be able to get that much of personal attention, but you can start out with beginner classes, maybe just 15 minutes initially, get in a comfortable spot and try. If you're bending and it feels uncomfortable or you're starting to have any discomfort, don't do it. Just do gentle yoga, move into it, and don't expect to be, Olympic quality athlete on your first go round. Allow yourself to slowly move into it. And the more you practice it, the more it'll come to you little by little. Be patient. The older and less flexible you may be, the longer it may take to return to a better piece of conditioning and flexibility. But it's really the action of trying and of doing the procedure and of getting yourself in the mental state that will cumulatively wind up making you feel much, much better, and it's good for you. So anybody can try it. I've had people who are, way overweight, people who had injuries that kept them from being able to bend. And no matter what, you can try the pieces of that puzzle, put them together, and you're going to find that it's going to make you feel better progressively. Definitely try.
Great. Do you have a favorite book on meditation or presence?
I wouldn't say that I have a favorite book, but I will recommend right now, if for people that are struggling or feel emotionally a little detached, that a pretty quick read and something they can get their hands on is something called The Four Agreements. All right. The Four Agreements are some ancient Toltec wisdom that's been boiled down into some easy remember and believable tenets that I think get people through a lot of difficult times in their lives. Um, Maybe Hannah, you can add that to our list of links or connections of the title of the book and the author. I think it's a small paperback. You can probably get it from Amazon or online for very little money.
Okay. How do I know if I'm meditating the right way?
Well, firstly, there's no right or wrong way. What we want is the positive effect. But if you're trying mindfulness meditation, what I'd encourage you to do to begin with is to first send yourself some love. Allow yourself to be wrong with the way that you're doing it or to make a mistake. You don't need to be graded on any of this. You just need to get into a place where you're comfortable with trying. And the more that you try, the more it will come to you. Just go ahead and concentrate initially on your breathing. What I tell people to do, and again, I'm no teacher, but I can tell you from my own personal experience, get in a comfortable position, quiet area, feet flat on the floor, back well supported, a gentle bend in your neck forward, and close your eyes gently. Take a few deep breaths in and out slowly. And then, as you breathe in and out, begin to count your breathing. Relax. Soften your back, soften your shoulders, soften your jaw. Let yourself relax and count your breathing. When you notice that you're losing count or you're starting to think about something else or you have a distraction, don't get angry or frustrated. Just say, okay, I knew that was going to happen. Come back to your breath and breathe in and out slowly and count again. I find that when I get to about 20, I like to start over because I don't feel like in my mind saying 21, 22, 23. But you can do whatever you like. Some people actually use a mantra word or will say in their mind, breathe or relax each time they breathe out. The way I was taught was to count. And you'll be amazed when you practice this after a while. Again, relax, hold your hands very loosely in your lap, or find a comfortable position. Switch positions if you're uncomfortable. But you'll be amazed how long you've actually been meditating once you get into this. I have had personal experiences as well experiences of my patients and friends who didn't realize that they'd been meditating for 30 minutes when we told them it was time. Go for a couple of minutes to begin with, see how you feel, and try to make it a regular practice each day in a comfortable, calming environment, and it will come to you.
I'm thinking about starting meditation with my family. Can children meditate?
Hmm. I think it's hard to keep little children focused like that, but I certainly think it's something that they could try. I know that I have one family who will pray together, and in a way, that's a sort of a meditation, a sort of a vibe. So you could try to get them to do it. I'm not an expert on that from a pediatric perspective, but I think maybe quiet time or something to focus children in some way might be a useful thing. I sometimes feel, and this is of course just anecdotal, but I think kids today are bombarded with stimuli. You know, the TV's on, the iPad's in their hands, the Game Boy's in their hands. They're getting, their earplugs in and they're getting stimulus from 20 other places. And they're so bombarded, I think they begin to actually extinguish some of that stuff and not notice things anymore. Maybe having a quiet time where we just think about what's in front of us and breathe deeply and enjoy the sounds around us might be useful for kids, but I'd have to give that to a child psychologist to know for sure.
I think you've outlined a lot of great practices. How many times per week should I be doing these things?
I'm going to recommend right now daily. Okay. I think making time in your schedule for a daily routine that incorporates some of the things we talked about that feel comfortable for you is powerful. Set yourself up a schedule. Even though you might not be going to work as you normally were or leaving the house as you normally did, get on some kind of routine that can act as an anchor to making you feel both accomplished and settled. And maybe that includes 15 or 20 minutes of yoga in the morning. And maybe that includes, 10, 15 minutes of a meditation practice in the afternoon. Maybe that includes a 2-hour siesta, after lunch. Um, Maybe that includes a little time when the TV's off, when everybody just relaxes and either reads a book quietly or just has a little bit of thoughtfulness and time out. Maybe that includes a daily walk around the block at a time when you don't see very many people and you can maintain your social distancing. Or maybe that includes, a little bit of space in the garage with some dumbbells or with some heavy weights and some exercise, get a good sweat on, and then a shower or a nice bath afterwards. Build the routine. Watch how that sort of guides you through goal setting throughout the day. Congratulate yourself on executing and on doing this well and keeping yourself healthy. Eat intelligently and plan your meals together with people. Maintain some social interaction either through the internet or through FaceTime or from talking to your neighbors at a distance. Do these things and we'll all get through this together with a lot more health.
Okay. What type of diet is best to follow?
Well, that's obviously an individualized question, but we know that in terms of immunity, it's reasonably well accepted that processed foods that have a lot of triglycerides, fat, and additives to them, are not good for your immune system. There's arguments pro and con about high carbohydrate diets or whether keto diets are good or bad for your immune system. But in general, what I tell people is where it's possible, fresh foods, both fresh vegetables and natural foods without a lot of processing, are definitely a healthier choice to make and seem to be less likely to stimulate things like hypertension or diabetes. You probably want to watch out for too many fried foods or greasy foods, avoiding the fast food option, even though drive-through may be easier for some people now. And don't overeat, because since you're home all day long, the refrigerator and the cabinets are handy, so we want to stay away from those. Stress eating is definitely a problem. A lot of times when we feel like having something to eat, we're really thirsty and we just don't identify it. So try a glass of cold water or some sparkling water or a sip of a drink rather than eating in between meals or adding on those extra pounds. And if you can get lots of fresh fruits and vegetables and a mixture of lean proteins in your diet, that's probably the best balance.
I'm curious about the use of probiotics. Is there a downside? Can you take too much?
I think you could probably take too much of anything, but a probiotic might not be a bad idea, especially since there are often antibiotics in some of the food that we're eating. It turns out that about 80% of all antibiotics that have been prescribed in this country are actually used by agriculture or by ranching. And healthy animals are given antibiotics so that they can be kept in very difficult conditions under stress. Chickens, beef are fed antibiotics even when they're not sick in order to prevent infection in the way that they ranch them. So probiotic may help restore some of the normal flora in your digestive tract, which we need. It's not a bad idea to take one of those on a daily basis. I wouldn't go overboard. Usually a little bit of yogurt with active yogurt cultures every day is a healthy way to go, or a probiotic capsule is reasonable. I don't think there's any advantage to taking huge doses of that. I'd stick with manufacturer suggestions or maybe a few scoops of activated yogurt every day.
Okay, so the last question is just about Insight Life Care. What is the difference between Insight Life Care and my regular doctor's office?
Well, I think there's a whole lot of differences. Insight Life Care is a concierge internal medicine practice that functions in an entirely different way. Our focus is on a direct relationship with the patient rather than any intermediary like the insurance companies. In fact, we do not contract with insurance companies. I often hear from people, gee, do you accept my insurance? And my answer to that is, well, we work a little bit differently. We're a membership-based practice, so we ask for a very reasonable fee on a monthly basis to allow you constant access to your doctor and to our team at the office, which includes a very well-trained and experienced nurse, not somebody masquerading as a nurse or without licensing and experience. You can come and see us as often as you want. There's no limitation on the services. And everything that we do within the office is completely covered. So you never get another bill from us again. That includes hospitalization as well. So all of the medical services of the doctor are covered. Yes, you will have to pay the hospital or the lab, and that's why we encourage people to keep either a catastrophic insurance or some sort of healthcare insurance. We can help people who have no insurance. You can still come and see us, and anything that we do in the office, there'd be no additional charges for. So that can be a very big cost savings. For less than what most people pay for their dry cleaning on a monthly basis, you have 24/7 access to a doctor, both in and out of the hospital. And that also means that we can do telehealth conferencing at no additional charge. You can call us for a visual appointment or for help on the phone 24/7. You don't have to go through a complex answering service either. If you leave a message for us, we get back to you promptly. And after hours, you can call me directly on my cell phone as if I was your buddy or your pal, which I'll try to be. But even if we're not the closest friends, we'll certainly be able to work with you respectfully and professionally. In many, many instances, we solve problems that other people have not had the time or the inclination to dig into. That's another big differentiator about our practice. In our practice, appointments are booked for an hour or more. We measure our appointments in hours rather than minutes, and we don't believe that you should have to wait. So if you come to the office, typically in the past, let's say for a 10 a.m. appointment, we're usually ready at 9:45 and we don't have any excuses. When we know we're going to be behind or when we've been stuck out on a house call, we try to call the very next patient and let them know as fast as possible that we might be delayed and offer them an opportunity to either reschedule or wait just a little bit, and we'll be right with them. That's another service that we make available as well for people that want it, we can arrange house calls to the patient in their home or in their ALF or at your office if you're a working person and don't want to or can't leave work in order to attend to various medical needs. We also don't just leave you in the lurch when it's time to see different doctors. Say we decide together that you need a subspecialist. If it's an urgent matter, you'll see either myself or my nurse getting on the phone, calling and making that arrangement for you on the spot and really expediting the care. And our testimonials are full of individuals who really feel safe that things that were urgent were dealt with immediately rather than a potentially really dangerous delay. Also, if we say, go get a scan or go get a test, we don't just hand you a prescription and say, good luck. We arrange all of that for you and make it as easy for you as possible wherever we can make an appointment, we do. Finally, there's not a no news is good news approach. We call back each and every result, whether it's normal or abnormal, and we're happy to get on the phone with you and talk about what the meanings of those tests are, or to make a follow-up appointment where we can relax and talk about it either in our conference room or in our comfortable examination rooms. So we're very different. We do things in a beyond normal service way, and both service to the patient and excellence in our clinical care is the hallmark of what we try to do. There's no limitation on how long we can talk or any questions that are silly questions. They're all good questions. And we have a tremendous amount of satisfied individuals who have become part of our medical family, and that really is the juice that gets us going. That's what makes us happy. And a lot of patients who have either found frustration with other practices or have left other practices and lost faith in their medical care have really felt renewed and rejuvenated by the attention that we've been able to provide them. You know, a busy day for us is maybe seeing 6 or 8 patients in the office. Of course, the phone rings an awful lot, and those 6 or 8 patients got a lot of time from us, so it's not like we're sitting around on our hands. But we build our schedule so that we always have availability. And in fact, if someone calls, our promise is to either see them or come up with an agreeable plan within 24 hours. So it's not, well, I tried to get into my doctor and I couldn't get in for days or weeks, but rather, yeah, they saw me that day or they saw me the following morning and I really felt like I was attended to. So that's just some of the differences, but we're proud of those differences. So in summary, I'd like to say thanks very much for listening and hearing some of these ideas. Remember to try and set some very small goals for yourself each and every day. Mentally rehearse what you want to achieve and what you're going to say to yourself with self-talk. Make it something positive. Remember to use the acceptance commitment therapy technique of not freaking out when something bad happens, but remembering that you can handle it, that you expected there to be clouds in the sky, and that there will be sunshine. You just have to get through it. Stay centered and grounded. Help yourself get there by doing some exercise, maybe trying some yoga, going for a walk, doing some stretching, considering some breathing activities that will really be helpful, and making sure that you have a routine, going to sleep on a regular basis and getting the best quality sleep that you can. Control the nature of your arousal by deliberately driving yourself towards calm. One thing I also want to mention is I would strongly suggest not watching the news all day long. Stay informed, but a constant feed of this information, which is designed to sensationalize and oftentimes aggravates a lot of people, isn't necessary and isn't helpful to rest your mind. Get the information you need and then move on. Watch something pleasant, but don't keep the TV on all day long listening to either political battles or economic battles or anything else. You know what's happening well enough and you can get the information you need. You can also tune in to our Insight Life Care website or to our Facebook page for daily concise updates. So I'm Dr. Chris Nussbaum from Insight Life Care. I want to say thanks very much to the Greater Chamber for letting us have a chat with you today, and we welcome any questions that you might have, and we wish you to stay safe, stay separated, stay smart, and be well. And we look forward to shaking hands with you when we're all able to do that. Thanks.